to their attention. And you can see that when this particular report came out, which was about a month ago, 95 breaches have already compromised the healthcare records of millions and millions of patients. And as a matter of fact, the most celebrated of these breaches most recently was when Franklin, Tennessee-based Community Health Systems actually had a data breach that affected 4.5 million of its patients' records. This hack appears from China and looks like it occurred in either April or June of this year. So you can see this is a worldwide threat, and frankly, most of these hacks that happen and most of these thefts are not per se to steal the patient records because they're looking to expose Mrs. Jones' problems with alcohol or Mr. Smith's problems with depression. They're rather, for much more practical reasons, trying to gain these individuals' information for a variety of issues related to their financial information, their Social Security number, and as you saw in the earlier slide, to actually file false insurance claims on behalf of the particular individual. So we have a worldwide menace right now, and in most records that I have seen today, these hackers are actually outpacing the organizations that are putting the security in place. So as good as the security issues are in most of the systems today, the hackers are one step ahead of the game. So what are we going to do about all this? Well, first off, in the meaningful use terminology, of which most of you are probably familiar, HHS has been very specific about the importance of all healthcare organizations to work very hard to protect patient information. One of the key objectives taken out of Stage 2 of meaningful use says to provide and monitor privacy and security protection of confidential information through operating policies, procedures, and technologies, as you can read for yourself, respecting regulations as we're going on. And the measures that that are supposed to be guided along in this vein are the governance model of the particular organization, the HIPAA privacy and security program, risk assessment and mitigation processes, and you can read the other items that are in the measures category. For those of you very familiar with meaningful use, you know that in Stage 1, a requirement was that a risk assessment be done of the particular organization, but nothing more taken other than the fact that those things are identified. When you get to Stage 2, things get much more specific, as you're seeing from this particular slide. The federal government is actually expecting that healthcare providers become very active in terms of the processes that they follow to do their part in trying to protect patient information. Along the lines of best practices for achieving this goal are the following bullets: reviewing governance, privacy, and security programs throughout the organization, implementing a very strict security governance process, making sure that privacy and security are actually in the organization's strategic plan, addressing the internal controls that are related to the HIPAA and other federal and state regulations. Then, on an ongoing basis, conducting regular evaluations of the process to make sure that they are in place, that things are being taken care of, and most importantly, the last sentence in this particular bullet, to understand the gaps and prioritize the improvement efforts. There should be an ongoing and documented process for evaluating these privacy and security programs, not as a one-time program, but rather as a recurring assessment to consider these changes. At the same time, the expectations are that there will be enterprise-wide risk assessment and management going on at all times, and that new and enhanced training programs are put in place, coming down from the board all the way through the organization, and reaching out to, if it's an academic institution, medical students, residents, and fellows, and then reaching down, which every organization has today, to its volunteers, its contractors, and any other individuals who do business with the organization. Now, if you take a look at this list, you say, how can I handle all of these items and still conduct my organization with its primary focus of taking care of patients? And oh yeah, by the way, I've got to make sure that I control my costs. Everything that you see on this list adds cost to the organization. And depending on the size of the organization, obviously the costs are significant. But even in a very small critical access hospital or a health center or a 1 or 2 or 3 doctor practice, every one of these bullets has a certain amount of cost that comes with it. So how do we try to address this issue in the most cost-effective manner and try at the same time to be able to meet requirements around HIPAA policies and procedures, addressing business associate agreements, making sure that all our data is encrypted at all times, reaching down to as simple as the mobile devices that all of us have and all of us use in terms of patient care, and make sure that there's an ongoing method of HIPAA security training so that every individual in the organization is sensitized to every aspect of protected information, so that something as simple as asking Mrs. Jones about how she's doing with her depression out in the waiting room is never happens. And if there is a potential breach in the organization, that the organization can take immediate steps to address this. Well, we've put in place here at Coker a program that we think will help address this in a very economical way. And we're going to spend the rest of the webinar today talking about just that. We call it our Healthcare Data Security Assessment and Remediation Program. So it is not only a review of the organization's security issues, but it is also a way in which the organization can address those issues, not just on a one-time basis, but on an ongoing basis as well. So what is this program? Well, it's 4 phases, and it will assess, recommend, correct, and monitor on an ongoing basis your security program, so that once you embrace this program with us, you can find that you will have a partner who will be able to help you in all aspects of the program that you saw on that best practices slide a few slides ago, and that you can have the comfort that your program is going to be monitored on a regular basis, and should there be issues, that they be identified in as timely a manner as possible. Getting into a little bit of detail, the program starts with an organizational assessment. This is a comprehensive overview of your current program for assuring that your protected health information, or PHI as it's commonly referred to, is being cared for appropriately, and everything from the care sites to the business offices where data is needed for financial and clinical reasons is being monitored closely. We actually start with the requested completion of questionnaires by all staff who come in contact with protected health information. The important thing to note here that this is not just a regulatory exercise, but rather it's an educational exercise as well. So by getting staff engaged from the very beginning, we start with a process that allows the staff to begin to understand what is going on with protected health information. In several of the organizations that both Kyle and I have been in recently, we found that there is a great lack of sensitivity and indeed a great lack of knowledge by most people in the organization, from the management team on down, as to the importance of caring for protected health information and making sure that breaches are minimized and then cared for appropriately should they happen. I've had situations where physicians have actually looked at me with their eyes wide open, saying they have no idea what to do if there were a security breach in their office. I've walked into offices and found doors wide open where access to either very highly sophisticated server equipment or indeed patient records is exposed, screens that are left on for 5, 10, 15 minutes at a time in full view of everybody from patients through anybody who comes in through the street, and no one really having a sensitivity for whether this information is protected information or not. So the biggest issue that I'm seeing in organizations today is just a lack of understanding. And it's not because people don't want to do a good job. Most people today know that they shouldn't be discussing Mr. Jones or Miss Smith's health issues in the waiting room or in the checkout line at the supermarket. What they don't realize is all the ways in which this data can inadvertently be shared, to say nothing of the fact that break-ins, such as occur at Temple, or more sophisticated hacking that occurs by very technically oriented people a continent or two away, can have the kind of effect it can have on people's lives, and indeed put the organization who has gathered that data at tremendous financial, clinical, and organizational risk. So the questionnaires, once they're completed, are then reviewed with the people completing the forms to assess completeness and accuracy. The other important thing is to identify through on-site reviews where and how key information technology hardware is being kept and maintained, where paper is being stored that is awaiting being shredded, and indeed if paper is in use in some way in the organization, how it is being cared for. We then close out the first phase of our operation with a report of the findings that focus on potential data exposures, variances with current standards, and recommendations for correction and the proposed remediation plan. You'll see examples of this a little bit later on in the presentation of some real-life question and results that we've taken from other organizations. The presentation is then given back to the organization, both in PowerPoint and booklet documentation, again, under the guise of education and making sure that everyone understands what's going on here, understands the importance of addressing the issues, and then is primed towards addressing those issues. The assessments phase is best reviewed in a diagram such as you're looking at here, where after project initiation, there's information that is being gathered. This is an actual diagram from an assessment we've recently done, and the reason why it is in multicolors is this was a work in progress. So you can see when we presented this to the organization, we said to them of the pieces that were not done yet, you can see it's the last gray box, the technical vulnerability or penetration testing, which we'll speak about in a little while, something that was in process, and then other things that are obviously completed. So we move from the information gathering stage to what I was just talking about, to the review and analysis, identifying the risks and the gaps based on the recommendations, and then move to an assessment report and the management presentation, and hopefully will then lead to action. The assessment scope really speaks to some key areas. It speaks to operational controls, security methods that are in place through the entire organization in terms of physical security, media safeguards, inventory controls, and organizational policies and procedures, which oftentimes are found to be quite lacking in terms of their ability to really instruct individuals to what to do in the case of a situation where there is a breach, or what's much more likely, that the automated system actually goes down and people have to resort to paper capture of data for a period of time until the system comes back up and that information can be put back in the system. We then take a look at, through the assessment management controls, how the actual IT security system is being managed, both from an ongoing basis as well as a security basis, and then the technical controls based around the hardware and the software. So our second phase gets into the whole area of penetration testing. And at this point, I'm going to invite Kyle Chang, my colleague, to jump in and speak a little bit about the importance of penetration testing as part of the security review. Kyle?
Great. Thank you, Charlie. You know, one of the things that, just a little bit of history on early on when we were really big into building EMR systems for small or large practices, and they would call us in to perform IT assessments. One of the best ways for us to understand how the infrastructure has been built either by internal IT or from a third party is effectively perform penetration tests. It's part of our IT assessment, and once I run a scan on the network, I know where the weaknesses are within an organization. And during the penetration test, that allows me to find out, how many. Not only does it do an inventory, number of nodes on a network, but it allows me to discover where the weaknesses within each individual workstations are. For example, we'll find things like, do you have malware on the computer? Are you lacking in Windows updates that can cause you to have malware on your computer? Or if it's something that it's maybe out of your control, where there's a piece of software that you may have inadvertently installed through an update from a third-party vendor that opens up holes within your workstation. Those are all things that I think, and we'll talk a little bit about this later, but those are all things, as we have in the slide, it's literally like breaking into your house, because of weak locks or smashing a window. I mean, there are always ways to mitigate it, but having that ongoing penetration testing, I think that is very helpful in really trying to understand the security of your organization. Next slide, Charlie, please. In the tech world, ports are very important because that's really effectively how workstations communicate with servers and networking devices. And it's, in a number of situations, we have found open ports are one of the main causes of why a workstation will receive malware, for example. And people do this all the time, and this is where controls come in, where a particular workstation is effectively broadcasting on a network that they have a folder that's wide open to the network, and we see this all the time within organizations. The users want to find an easier way to transfer files with each other, and there are no mechanisms or controls within the organization to be able to share files. So things like that happen. The users find ways of creating their own mechanisms to share files, and this is one of the things that we find through open ports as we perform our scans. And what's nice about these scans is we can sort it out, every individual workstation's device. After we do the scan, there's a report, and within the report it says this workstation from this department has this vulnerability in it. This is how you're going to remediate. This network device from this department, from this organization, has this vulnerability, and that's how we're going to remediate it. So, having things like this, it's really important for an organization to have this. I mean, it's not just the fact that, because of meaningful use, but overall, it's going to really help you as leaders of an organization, really help you figure out where your IT weaknesses are. Is it weakness within workstation level? Are you up at the system level where you have weaknesses? Or do you just simply not have the tools available for your staff in order for them to share information? That's one of the key things. And we've seen it time and time again when the mechanisms are not there. Unfortunately, humans are very creative. We're going to create new ways to figure out how to do the things that we need in order to get through our day.
So moving on then, as we get through these first two pieces of the analysis, we then get into what's the most important and most practical for the organization, and that is the remediation phase and the ongoing monitoring. What we do in our program is the first two phases are priced out independently, and then phases 3 and 4 are kept open because the remediation phase is definitely going to be different for every organization. In those organizations that have done a good job, that remediation is going to be minimal. In organizations such as some of the ones that Kyle and I have spoken about, it could be rather significant. So we wait until we've gathered all of the information, until we begin to discuss in much more detail with the organization what the remediation program needs to be. And we work towards arriving at a mutual agreement of who's going to do what and on what time schedule. You will see in the ensuing next 3 slides that we do break our recommendations down into high risk, medium risk, and low risk. Those high risk items should be addressed immediately within about a 30-day period of time. The medium ones probably within about a 90-day period of time, and then others as can be taken care of. And the reason for that is twofold. One is that high-risk items obviously are there because there's a high vulnerability that either a breach can occur, has occurred, or that should a breach occur, that the system is really wide open towards sharing a lot of inappropriate information. The other reason for doing this is that any organization has to be ready for the fact there's going to be that inadvertent breach that could happen for something totally outside of their control, such as a hacker from another country who's got a very sophisticated program. When and if a breach occurs, the fact that the organization has a good security program in place is as beneficial as when an organization has a malpractice breach happen and they have to address things. The better that the organization can show that it has taken every step possible towards addressing the issue, the more the likelihood that any kind of legal exposure coming from this is going to be less than should it be in a situation where the organization was not addressing these issues at all. And then in addition to the remediation program, then we developed this ongoing monitoring program, which you'll see in a couple of slides following the ones that relate to specific examples. So what you're looking at here are actual results from a particular survey that was done, and obviously these are considered high risk. In this particular survey, I would say that the organization was probably at a medium level of problem. We've seen worse, we've seen better. This group was somewhere in the middle. So you can look at, on the left-hand side, some of the breaches that we saw. For example, dealing with third parties due to a lack of third-party agreements, sometimes often called the business associate agreements. Unauthorized people being able to gain physical access to the facilities. We saw doors unlocked leading to server rooms. We saw servers stored in hallways or in rooms being used for other purposes. There were technical vulnerabilities where people could gain unauthorized access to the data due to lack of controls, whether they be weak passwords or whether they be non-existent passwords, or the fact that information is being given out to other parties. There were examples here where actual access was granted to third-party connections, either remotely or directly, which is a huge red flag in terms of identifying this stuff. There was no program in place that could prevent unauthorized users from gaining access to the operating systems if they claimed to be an authorized user. And there was very poor controls in place with regard to the destruction of media, whether it be paper documents or whether it be outdated computer media such as tape disks. There needs to be a good program for disposing of this material, just like there is with regard to paper. So as a comment to each one of these items, you can see that we got to some level of specificity. And you can see, for example, with the first breach that we saw, many practices were unaware that BA agreements needed to be in place. With the unauthorized access to the physical facility, back and side doors were left unlocked. Going down the list, again, you can read a number of these for yourselves. Jumping down to the one that talks about unauthorized access gained to information systems. Some sites did not have unique IDs for users. Auto log-off was not enabled, etc. And going all the way down to the bottom, where you had media disposal not occurring properly, there were examples where many sites had functioning CD-ROM drives and USB drives which were able to be plugged into systems, which could then pull this data off into tools that obviously had little to no controls over them, and they could actually be removed from the organization. Now, we are not trying to prohibit the effective movement of data. In meaningful use, there's a very clear requirement that patients have access to their data, and indeed, if they wish it on a CD-ROM or a USB, that it should be made available to them, to say nothing of the fact that they should be able to get data through their own personal health records. That's a different story, because in those circumstances, the patient is specifically requesting their information. In the cases that we are seeing here, the same tools that could be used for patients getting access to their data were also being used by others who were potentially pulling that data off for other purposes. So there's an important balance here that must be struck between securing the data, securing the systems, and making sure that we're not prohibiting the systems from being able to provide patients with the kind of information that they need and by rights is theirs. The next category down are the medium risks. As you can see, in this particular organization, we identified 6 such medium risks, and we identified them in much more specificity. So, for example, information around risks and risk control options were not effectively being presented to management before management decisions were being made. There, if you remember, in the best practices, there was an identification that everyone from the board on down be sensitized to the proper care for protected health information. Well, nowhere in the records of this particular organization could we see any evidence through minutes, through actions taken, through practices, that indeed management was considering these things as is appropriate. The third bullet down gets to the fact that users that no longer have a need still have access to a system. That needs to be taken care of on a regular basis so that the monitoring program is active and current and stays closely tied to the organization. You can see the second bullet from the bottom talks about the fact that security incidents are not managed with a consistent and effective approach. This particular organization had no method for effectively capturing its information in a clear, concise, and consistent manner for when and if a breach would occur. And indeed, they could not even tell us if breaches had occurred in the particular offices in which we were looking, because there was no way to be able to cover and control that information. And the organization did not have anything documented that would identify how data could be captured in the case of a written disaster where the actual system would go down due to physical issues such as weather or other issues such as fire or destruction such as occurred in the organization in Temple where the computer was actually stolen. So you can see on the right-hand side, again, our comments along these things. You can see that the second bullet down spoke about the fact that servers and network equipment were located near water heaters or in attics or located in closets or in rooms that did not have locks and were very accessible during business hours. There were no policies and procedures for third parties to destroy effective patient information after certain services were completed, and that the sites did not have any documented backup recovery or disaster recovery plans. There's another practical aspect of this that is very, very important, and that is business continuity. As we as organizations are becoming highly automated today, there will always be the real and present danger that the automated system could go down. And in that case, what is being done to be able to make sure that care can continue to be rendered and the data continue to be captured so that when it's appropriate, the information and the system comes back up, the information can be put back up into the system and business continue then as it did. Some last few medium risks around people and process. Management had not defined responsibilities for any kind of a security information security program. There was not a clear policy direction for commitment to information security, and information around these items were not presented as options before management decisions were made. Again, getting back to the fact that every aspect of an organization, from its governance down through the volunteers that work with it, need to be sensitized to what's going on here. And again, you can see in the comments information that relates to that. One specifically, the second bullet in, was there was a lack of training beyond basic information, such as patient sign-in and sharing of patient information once the patient is in the organization. So while we look at breaches in security and data sharing as oftentimes very large issues, such as the ones we talked about at the beginning of the webinar today, there are many instances that can have just as deleterious effect on the organization that could occur on an individual basis. You get a patient who is dissatisfied about care that's being rendered, and all of a sudden they connect with a rather informative lawyer, and you can have a lawsuit on your hands that could result in millions of dollars of damages being paid out simply because of some of the policies and procedures that are not in place. So as part of our program, we put these together, we develop a list of these policies and procedures, and then we develop, as we said before, a remediation program. Now, the ongoing monitoring of the technical equipment is also part of that program, and I'll let Kyle step back in and speak about this in a more detailed basis.
Thanks, Charlie. Well, you know, one of the things that we've, well, let me take a step back. You know, one of the things that before I went to college, my dad said to me, don't engage in risky behavior, and I'll let you all take that as it is. And, you know, we can have all the security tools out there that can do the one-time scan of your environment. You can perform the remediation, but fact of the matter is you really don't know how your users engage in behavior throughout the day and how they work. We've had a number of reports of just even, you know, getting some sort of Facebook virus or downloading files from the internet, and those are all behaviors that where we can put in, there are content filtering and website filtering devices out there that are capable of that, but we just don't know how, if we're going to miss it or not. I mean, you can never ever be 100%. What is 100% is the continuous scanning, the surveillance, and really the educational portion of it. And, you know, we think with the organizational vulnerability scanning, making that a more of a routine process rather than when it's on demand or when you're required to do it. I mean, those are all the programs that are going to keep an organization safe. It's the scheduling aspect of it and having that persistent scan with remediation throughout once a week, once a month, and however you want to do it, but just continuously maintaining the level of security that you need to have within your organization. You know, what's nice about a lot of these tools that are out there for vulnerability scanning is you can develop a per organizational or per team or per department policy, and it doesn't have to be cookie cutter anymore. You know, a lot of them out there are, and every team within an organization, they've got their own policies for how digital data is secured and managed. One other thing that I want to throw out there, and we really didn't get a chance to talk about, and Charlie, maybe our next webinar we can talk more about just the plethora of available tools that are out there on the internet that hackers can get to that are free, which can, they're essentially, these are free tools out there on the internet, and any hacker can download it and use it to effectively breach your network. It's one of the big reasons why I think the number of, and also the exposure is a little bit higher. I think our temperature for looking at hacks and security breaches are a little bit higher these days, given all the media about the Apple iCloud hacks and Evernote, Dropbox. I mean, all those. I think the media is very high on it these days. But the fact of the matter is, there are free tools out there that basically they're tools originally used to help IT administrators or security administrators, network administrators, and one man's tool can be used as another man's weapon. So that's why we think having an ongoing scheduled vulnerability and surveillance scanning program is very beneficial, especially in the healthcare setting.
So we've tried to show you our entire program from all 4 phases of the operation. We want to assure you that we didn't just put this together off the seat of our pants thinking, gee, we have something here which the market needs. It does need it, but it is based on some very specific standards. And you can see on this particular slide here, we list those standards that we are drawing from. I've mentioned HIPAA in a number of cases. There's also several publications that have come out of the National Institute of Standards and Technology, or NIST, from which we've drawn from, and then also, of course, the High-Tech Act, which gave rise to meaningful use. So in terms of what you as an organization need to do, hopefully we've educated you a little bit today in terms of the issues that are out there, both the broad as well as the very specific vulnerabilities that you have in your organization. Now, what do you need to do with that? Well, the first thing you need to do is evaluate your individual threats and develop an enterprise policy within your organization. How vulnerable are you towards any of the things we're looking at? You can never sit back and say, I'm absolutely squeaky clean, I am totally insulated from this, because we know that's not the case. No organization is. When Bank of America or community health systems has breaches going on, you know that everybody is going to be vulnerable in this regard. But by evaluating the level of your particular threat in your organization, that's the first step towards being able to do your best to be able to protect yourself against it. You should consider appointing somebody as a security advocate in your organization. Doesn't need to be a specific position, although the more sophisticated the organization, the more developed that role needs to be. But it does need to include many of those bullets that you saw in the second slide in. And those do take some time. They do take some effort. The third thing is to determine if it's time to perform an in-depth security assessment in your organization. Whether you do it yourself, or whether you bring a company in, such as ourselves, or you employ somebody else to do it, you need to determine whether it's time to be able to do something like that. And you should really seriously look at the importance of the assessment. It's not just something that you did to comply with meaningful use stage 1. It's much bigger than that, much broader than that, and much more dangerous than that should there be a breach in your particular organization. If you'd like to learn more about our particular program, then we welcome your questions and answers today or on an individual basis. We think we have a rather unique approach to this that keeps costs down and gives you the kinds of security that you need on a long-term basis. So with that, I'm going to stop, and we are going to begin to take some questions. I see the first one that has come up on the screen. It says, is there any way I can find out if I've been hacked before my data starts showing up in the wrong places? Kyle, I'm going to let you take that one.
Well, that's sort of like asking, can you help me find out if I have the flu or if I have the cold? I mean, there are always symptoms of a particular hack, and the best way is really just to call someone like our team to go into your network and just perform evaluation and run a security scan. I mean, there are a number of ways to view what is considered a hack. I mean, it could be as simple as having a virus or malware sitting on a computer, and that is considered a hack. You have not knowingly received a third-party piece of software onto your computer, and it could be doing damage to your computer. The worst hacks are the ones that that you don't know about. I mean, that's what we've seen in a lot of ways.
Next question. Again, Kyle, I'll throw this over to you. What should I do if my system is compromised?
Depends on the compromise. If you know that you have, for example, and again, it depends on which level. Our process really is, you know, if you, for example, if you have a workstation that you know has malware or Trojan on there, we tell that the users that call about that, we have them literally unplug that workstation off the network because you really don't know how these malwares and Trojans can affect your network and other users on your network. They could be as simple as replicating themselves and kind of churning away at your system and making your system slower, or their entire goal could be to turn away and suck up all the bandwidth within your network to the point where nothing and no one can get online. So, you know, I think the best bet is to really evaluate, and then again, going back to the importance of having ongoing vulnerability scanning. That's the key, and that's really important for someone to continue to review that for you.
You don't want to wait until you hear from somebody else that they have some of your data. You need to be able to determine when and if you have the vulnerability that's going on. So that's really what's important. Your system can be hacked. There's no question. Unfortunately, there's not a system in the world that isn't able to be hacked. So you should come from the perspective that I could have a breach occur at any time, in any way, whether it be technical or whether it be personal. The key is, what am I doing to be able to prevent that? Another question, Kyle, that's come up is, we mentioned at the beginning these national security breaches. What does that have to do? Why should that concern me? I run my own system. I'm not tied in with banks or major healthcare systems or directly to the government unless I'm submitting bills. Why should I be concerned about these major hacks that are going on worldwide?
Well, I mean, you know, it's same as taking the Hippocratic Oath. I mean, we've all, as healthcare providers, we've all taken the Hippocratic Oath of do no harm, and that's the same exact way. I mean, you know, to me, you do need to take the precautions and the safeguards and security out there in order to protect, you know, in order to protect that patient data, to prevent them from facing harm, and that's why we're out there. That's why we are in the healthcare business.
We had another question come up about when is the program available and how soon after I sign up can we get started. Our program is available now. As I mentioned in several of the comments, we are actually doing security assessments on a regular basis. We are starting to fill up, though, so we're trying to get to people as quickly as we possibly can. I would say if we were contacted by an individual now, we could probably get started in their organization within the month. Maybe even a little bit sooner than that. But those time frames are going to stretch out the more that we get busy along these lines. But we can do things reasonably quickly now, getting started with your organization and having, if you wish it, a full monitoring program in place within a few months. Any other questions that have come up?
All right, there's no more questions, and I'd like to thank Charlie and Kyle for their excellent presentation, and of course thank all the attendees for joining us for today's presentation. Please check back soon at cokergroup.com for details of our next Coffee with Coker in October, and please be expecting the recording of this presentation in the next day or so. Thanks, everyone. Have a good day.